Hi, I'm Clyde Yancey. I am the Magister Professor of Medicine and Chief of Cardiology at Northwestern University's Feinberg School of Medicine, and I'm the Associate Medical Director of the Bloom Cardiovascular Institute. As Chief of Cardiology, I really need to cast a wide net, and so I have a deep interest in all patients who either are at risk for or actually have cardiovascular disease. My own specific area of interest really caps about a 20-year focus on advanced heart disease, heart failure, if you will, heart transplantation candidacy, and those patients needing mechanical assistance because of failing heart muscles. But in the last several years, I've really gravitated back towards my earlier interests, which were hypertension and prevention. So I enjoy doing a little bit of everything. I think there's one key element when doctors and patients are in this very precious space that no one else can enter, and it's communication. It's clarity, it's transparency. I've discovered over the years that once someone really understands what it is he or she is facing and or understands what needs to be done to mitigate a risk or address a problem, the rest of it falls into place pretty easily. But I'm surprised how many times that fundamental level of understanding is just simply not there. So I really concentrate on a lot of eye-to-eye contact, face-to-face contact, a lot of Q&A, a lot of discussion, because I think ultimately communication really is the central efficiency, the central skill to have an effective doctor-patient relationship. Like many major academic medical centers across the country, cardiovascular services have been partitioned out. Here at Northwestern Memorial Hospital, we do that under the nomenclature of the Bloom Cardiovascular Institute in deference to some very generous gifting from a delightful family. What it's allowed us to do, though, is to aggregate. That means to bring together surgical services, vascular services, cardiology services, imaging services, all under one tent. You hear about economies of scale and maximizing efficiencies, but this is how it truly takes place, so that we work collaboratively. There are many times where a patient can make one trip to the Bloom Cardiovascular Institute, see the surgeon, the cardiologist, the rehab therapist, the nurse, have it all wrapped into a package and leave with a comprehensive understanding of what's wrong, if there is something wrong, and what needs to be done next. So this is not an institute in name only. This is not a convenience. This really is an interoperative collaboration of professionals focused on one objective: for the patient to have the best possible outcomes.